privilege or abuse my privilege as moderator to change the topic, because there's this paper that came out like a year ago that has been really driving me crazy. It's like a super meta-analysis, and it looks at open tibia fractures stratified by decade and look at outcomes, infection and non-union. And to make a long story short, what it found was that we have not improved our outcomes in 4 decades. But we have tremendously increased the cost of implants and how much we spend on doing this. And if you look at, for example, I went back to our hospital here and asked about old school implants versus new implants for a standard bimalleolar ankle fracture, and there's a 4 times difference with no difference in outcome. And so I just wanted to bring up real quick, Sarmiento, everybody knows the name Sarmiento, right? He's closed fracture king from Miami. We have Sarmiento braces we all use. But when I was a resident, I think he was a little bit later in his career, and if you look from around the turn of the millennium, you can find about 10 or 15 different publications, all focused from him on what he calls the orthopedic industrial complex, where we can get into the semantics another time, but the idea is that there's a lot of reasons why we might develop more expensive and fancier implants without improving patient outcomes. So we have all different kinds of nails that we use now for open tibia fractures. So I like to think we shouldn't change our practice based on just one paper. So maybe you guys want to tell me what you think. Help me answer this question. What did we learn from this paper? Are we not doing the right thing? Nick, what do you think?
In terms of that first of all, you basically sleep with a copy of this article under your pillow at night. I know, very, very influential to you, and you bring it up all the time, but it's really good food for thought. And I don't think any of the confounding variables or any of the weaknesses of it, which all the authors say in the paper, really do anything to change the fact that it's very thought-provoking